This is Next Steps for Seniors with your host, Wendy Jones. Each week, Wendy brings resources and information to help guide you through those next steps with elderly parents and loved ones. You can follow, subscribe, and share on your favorite podcast platform. If you have questions or topic suggestions for Wendy, you can call us at 248-651-5010 or email at hello@nextstepsforseniors.com.
Welcome to Next Steps for Seniors, Conversations on Aging. I'm your host, Wendy Jones, and as you all know, we talk about the things that nobody else likes to talk about. And why is that? Because we talk about real life. We talk about things that happen as we age. And guess what? Everybody ages. Everybody in the entire world. This is not like I'm the only one that's getting old. I'm the only one that's getting wrinkles. This is everybody. And as we age, things start happening to our bodies that we wish we knew more about. And that is why today in the studio, we have the Michigan Parkinson's Foundation and Julia Wall. Hi, Julia.
Hi, Wendy.
So glad you're here. She is the Director of Education. And then we have Stephanie Wozniak, who is an LMSW social work for the Michigan Parkinson's Foundation. How are you, Stephanie?
I'm doing great. Thanks for having us.
Yes, and we also have Katie Alexander, who is Special Event Manager. So we're very grateful. Hi, Katie.
Hi, Wendy.
So grateful to have you all here today. And it's really important as we age to understand that Parkinson's disease is something that is definitely one of the fastest growing neurodegenerative diseases, even outpacing Alzheimer's.
That's right, Wendy.
And if you've met one person with Parkinson's, you've met one person with Parkinson's.
That's right. Parkinson's disease is a very customized boutique disease. It is different and it affects everyone differently. It's so individualized, and so it's so important that people become educated and aware of what this disease is. Parkinson's disease is classified as a movement disorder. It affects the ability to move. It is often associated with tremors, slowing, and stiffening of limbs. Like you said, it is a progressive neurodegenerative disease where dopamine-producing neurons are slowly dying, leading to a variety of symptoms affecting motor and non-motor movements.
Can you explain motor versus non-motor movements? Because some of us are... Yeah, pretend like we know nothing, because I really know nothing.
Absolutely. I like to refer to them as seen and unseen symptoms.
Yes.
Okay. And so people are often familiar with Parkinson's with these extra movements, maybe tremors, maybe stiffness, slowing of movements, stutter steps, things that they can see, those symptoms. But there's a variety of non-motor symptoms or unseen symptoms, such as loss of smell, constipation, depression, anxiety, a variety of other symptoms.
And who would know that loss of smell could be a potential? I wouldn't have even thought of that.
It's actually been one of the first predictors of Parkinson's disease. It's a little more complicated now since COVID, because that's one of the symptoms that people have experienced after COVID is a loss of smell. But it's very interesting. Many people, when they get the diagnosis of Parkinson's disease, will often look back and go, I haven't been able to smell for a few years. Or, I've had problems with constipation for a couple of years. So oftentimes people don't know what they're looking at with this disease until after the diagnosis.
I feel like everyone associates it with the tremors of the hand.
Mm-hmm.
Don't you feel that way?
That is true. And about 70% of people that are diagnosed with Parkinson's actually have tremor. There are 30% of people who don't experience any tremor at all, but they have stiffness of limbs. They have rigidity. So it's very interesting, the variety of symptoms and how it affects everybody individually. And, we always get the question, where do you get Parkinson's from? How does it happen?
Yes, everybody wants to know that answer.
Right. Well, we don't have the answer. Unfortunately, it's called idiopathic Parkinson's disease because 85 to 90% of the time we don't know the cause. People are always worried about, is it genetic? And in fact, only 5 to 10% of the population has a genetic component. What we're seeing more and more of are the environmental factors.
I was just going to say environmental. Absolutely.
A very clear picture of environmental causes are our military, our veterans. Our veterans have an increased risk of developing Parkinson's disease. You can take a look at our Vietnam veterans who are exposed to Agent Orange, or our Marines that were at Camp Lejeune with toxic water. So there are significant environmental risks. The one I really like to get out there and educate people about are the pesticides and the herbicides. Roundup.
Please, yes.
Don't use it. Roundup has been tied with Parkinson's disease.
And it's still on the market.
It's still on the market. And do you know that it is made in China, and it is banned in China? And in fact, it is banned in most of the countries around the world except the United States.
And I'm telling you, I see people still using Roundup, and including my husband. And I say, do you know that's banned? Do you know that causes, and he's like, oh, they wouldn't sell it if that was still the case.
Oh, right. No. I know, isn't it terrible? Here's an alternative, vinegar.
Okay, there we go. So pesticides is a big thing.
It is. It is absolutely. And so are heavy metals. Toxic waters, rural communities with well water. I personally am concerned about what's going to happen in the city of Flint.
So Flint, Michigan had many issues with lead in their water, years ago, and you're exactly correct. So we need to be aware.
Right.
So what we're doing today is not causing fear. We don't want you to live in fear.
No.
We want you to live in peace, but we want you to be educated. And that's why Julia and Stephanie and Katie are here, because that's our goal, is to share this with you. So who gets Parkinson's disease?
Yeah, sure. So in Michigan alone, there's over 35,000 people that are affected with Parkinson's disease. Worldwide is 10 million. Over 10 million. So about every 6 minutes, someone is being diagnosed with Parkinson's disease. And men are a little more at risk than women.
And why is that?
I don't know that we have the answer to that. We don't know if it's because of more men participating in research studies. We don't have... Environmentally, for sure. Farmers, agriculture, our veterans, that possibly could be. We don't have a registry, which is something that I hope that we will at one day be able to have a registry to be able to know these numbers a little more in depth.
Mm-hmm. So let's talk about the pillars of what the Parkinson's Foundation offers. Because we're blessed to have organizations like you who support people with Parkinson's. We obviously, our big thing is education. I know that. So Stephanie, can you share that with us?
Yes, of course. So working at the Michigan Parkinson Foundation, we talk about our programs and services within 4 different pillars, which include community, exercise, education, and respite. So within our pillars, our community, we want to make sure that nobody feels as if they're alone in this disease. As we've, heard from Julia, it is a very complex disease, and there's many symptoms people do not even associate with Parkinson's. So we have a network of over 70 support groups across Michigan's 83 counties.
That is fantastic.
Yes, we offer in-person and virtual. A lot of people forget about the Upper Peninsula, but we are up there too. I just got back. So we offer, again, over 70 support groups, and we've actually developed a new program. It's a mentorship program. So we understand that sometimes people don't feel comfortable talking in a group or bringing up maybe some of those symptoms or problems that they're having that they don't want to discuss within a group. So we've developed a mentorship program where people can reach out to talk about what it's like to even be a female with Parkinson's or a caregiver. We have several couples who are in our mentorship program, and for those maybe considering having deep brain stimulation surgery. So we've have these individuals who can talk about these one-on-one for people who are just looking for some more support. So
let me ask you, the support groups, aren't they online? Because you could participate even if you're not in the local area, correct?
That is correct. So although we do have many support groups in person across the state, we do also have many virtual support groups for individuals who maybe are in an area where there isn't a group, or if they're even out of state, they have the opportunity to join. And we actually have support groups designated for veterans. We have support groups for African American individuals diagnosed with Parkinson's. We have what's the other one I'm drawing?
Well, we have our virtual education program, too, that really delivers a lot of conversation for people, perhaps adult children of Parkinson's people. We have a lot of physicians that will come in and talk about our education. What's so great about many of our programs is that we do offer virtual and in-person, and virtual is borderless. So you don't have to be in Michigan to take advantage of a lot of the programs and services that we offer. We have many people that join us from across the country, not just in Michigan.
Right. Even though it's Michigan Parkinson's Foundation, you have services for everybody. So one of the pillars you said was exercise.
Yeah. So our exercise pillar is that we offer free exercise classes via Zoom Monday through Saturday, and anyone can join. So those are done at 10 a.m. And again, we have care partners. We have adult children with Parkinson's who are also joining to support their loved ones diagnosed with Parkinson's. And so
exercise is one of the most important things from what I've been told.
That is correct. Exercise is proven to slow the progression of Parkinson's.
Okay, so if there's one thing you're going to take away from this segment, it is let's get moving.
Let's move
and we're going to transfer into our next segment. We'll be back in just a moment to talk more in more detail.
This is Next Steps for Seniors with your host, Wendy Jones. Each week, Wendy brings resources and information to help guide you through those next steps with elderly parents and loved ones. You can follow, subscribe, and share on your favorite podcast platform. If you have questions or topic suggestions for Wendy, you can call us at 248-651-5010 or email at hello@nextstepsforseniors.com.
You're listening to Next Steps for Seniors, Conversations on Aging. I'm your host, Wendy Jones, and our topic today is Parkinson's. And a lot of people just don't quite know. And our first segment, we had a fantastic conversation about the symptoms, what to look for, the loss of smell, constipation, things that people may not even associate with Parkinson's. But that's why you're listening to this program, right? Because there's so many things that we just are not educated on. So I am so grateful for you, both, all of you, really. We have a whole room full of experts here today. So I am grateful for you. So Julia, my next question is how talk to us about what's our first steps? Like if we think it might be Parkinson's, as you're listening to this program, people are like, do I just go to my PCP, my primary care physician, or what's the best way to start?
Well, many people will start with their neurologist, and they can see a general neurologist. They absolutely can treat Parkinson's and diagnose. But there's also a specialist called a movement disorder specialist, typically a neurologist that's had an additional 1 to 2 years of education, particularly with Parkinson's disease. That's the doctor that you want to see. I like to say that if you had cancer, you aren't going to go to your primary care doctor.
Right.
You're going to go to an oncologist. People haven't heard movement disorder specialists that much. And that's really who we encourage you to see. A doctor who's seeing someone with Parkinson's every day, 5 days a week, every appointment. They're going to be a little more skilled in medication management. They're going to know the physical therapy, the exercise, the speech, the programs that you need to get into.
Well, and people don't even realize that there is a movement disorder neurologist that
Correct.
You can see.
There's only about 628 movement disorder specialists in the country. We're lucky in Michigan to have over 30. But it is a small group of doctors that are dedicated to caring for people with Parkinson's.
That truly understand, exactly. So back to the education, because this is what we're doing right now, is we're educating. And I love that that's what you offer through the Michigan Parkinson's Foundation, because your goal is to just pour this knowledge into people. What's the best way to get this information from your website too, correct?
Yeah, I think definitely they can call us at 248-433-1011.
1011, okay.
Yes. Or they can go to our website, which is parkinsonsmi.org. Follow us on social media. Follow us on our YouTube channel. We offer a PD 101 class every month, the first Wednesday of every month at 10 a.m. That really, you can learn all about what you need to know, and that's the most important part. What do I need to know to be able to have a successful journey with this disease?
And for couples, husbands and wives, you said it's more common in men. Women who are caring for someone with Parkinson's, they need to understand. And I think that's it's overwhelming when you're managing something as far as being a caregiver.
Yeah.
So I know you offer something for that too. Stephanie, share that with us.
Yeah, so we offer many types of form of support, including caregiver training videos. So caring for someone with Parkinson's and understanding how important it is that they're getting their medications on time, that they're getting up and moving. So we actually offer respite care assistance through the foundation, where we have referrals as well as financial assistance for caregivers to be able to get away from their day-to-day and be able to take care of the things that they need to take care of and support their mental health. I think the one thing that often gets missed is caregivers matter too. It is a lot of work being a caregiver in general, so we want to make sure that those living with Parkinson's have that support throughout the community. So we actually have last year we've been offering respite care assistance now since 2018. So when I had joined the foundation about 2.5 years ago, I am pleased to say that we had a $200,000 budget, and just last year we spent over $300,000. So we wanted to make sure that we met the need, and as we continue to grow as a foundation and Parkinson's continues to also grow, we want to make sure that people feel that support and have the assistance. And being a social worker, I am a referral. I am a resource. So my day-to-day...
And she's fantastic. Let me just add that. Honestly, we have so many clients that call, and the second they when we ask what their diagnosis and they say Parkinson's, we're like, oh, we have a number for you to call, and we refer them, because you're so fantastic talking with the families, talking with the patients. Like, thank you.
Oh, well, of course. And I love doing it because, the things that I've learned since I've started is that once someone gets a diagnosis of Parkinson's, they feel very alone. They don't have that support after. They leave the doctor's office in question of, okay, go home and
now
try
what?
These medications. Now what? So it's since, I've started at the foundation, neurologists continue to refer individuals to contact us. And I spend many, many hours on the phone with caregivers and just trying to learn a little bit more about their situation, let them know that there is support out there, that they're not alone. And, I love what I do. I love providing the support in any way possible.
And I love that you said, exercise.
Yes.
Right? So you encourage them right on the phone. You're like, well, here's what you could start with.
Yeah, I always say, did your neurologist prescribe your daily dose of exercise? Because it is proven to slow the progression. And I always ask when I'm out in the communities even, who exercises daily, just to see how many people are moving. Because I've learned through my years is it really is so important to move. I like to say, if you don't use it, you lose it, right? Mm-hmm. So keep moving.
And it's mind, body, and spirit. Like it's so healthy. And we need circulations. We need to get outside. There's so much that needs to happen with exercise. So we talked about the 4 pillars. Did we cover all of them?
Yes.
Okay. So I love that you have this. I love that it's available. And one of the things that's really important is raising money for the foundation. And that's why Katie is here, because she is a special event manager. So tell us what we can all be doing and what you have coming up that might be important for the future.
Excellent. So all of these services we provide for free for anybody in Michigan. And so the way that we do that is through our signature fundraising events, which are our 4 walks and our gala that's coming up, all taking place this fall. So because we cover the entire state of Michigan, we have 4 walks in Traverse City, in Metro Detroit, which is in Utica, and also Lansing and Grand Rapids. If you're interested, the Grand Rapids walk is on October 19th. You can go to our website that Julia mentioned and register as a team or an individual. If you're also not able to come, you can make a donation at the website as well. And then our gala is on November 8th at Ford Field, and we'd love to have your support and participation there as well.
And I will be there. I
Excellent.
I am a big supporter of what you do every day. I'm very grateful for every one of you, because this is, like you said, the fastest growing neurodegenerative, say that really fast 3 times, disease, right?
Right.
Yeah.
It is. It's growing. It's very prevalent. And we have a lot of work to do. And we don't want anyone to feel alone. And that's what I think our best kept secret is.
It really is bringing awareness and education and knowing that you're not in it alone.
And it's not a death sentence. You know, if getting Parkinson's, it can be a crappy card that's dealt, but it's how you play the hand that matters, and we're going to help you.
We're providing hope in every step.
Exactly. Hope in every step. You are not in this alone. So anyone right now listening to this program that thinks now that they might have Parkinson's, okay, if you're just like, oh, this might be me that they're talking to, please do the number one thing she said, set the appointment.
Set the appointment with your primary care first, asking for a referral to a neurologist, hopefully eventually getting to a movement disorder specialist.
That's it. 1, 2, and 3 right there. And then there are medications you can start right away.
Yes, there is medication. There is medication that's been used for over 50 years. That is a very safe medication. But medication alone isn't going to get it. You have to exercise. By the time someone's diagnosed with Parkinson's disease, they've lost 80% of their dopamine cells. So you need to have a dopamine replacement, and that is in the form of medication, and you have to activate it, and that's with exercise.
Very important. So can you talk to us about the dopamine just for a slight moment? Because that is fascinating to me.
Well, it's not just the dopamine, actually, that is affected. There's the serotonin levels, the acetylcholine, other neurons in the brain that are affected that can cause mood disorders, anxiety, and depression almost lay hand in hand with Parkinson's disease. So it is so important. You cannot manage this disease alone. You need professionals. You need support. It's not an individual disease. It's a family disease. But it's overwhelming, but you can do it. There are a lot of resources out there. There's a lot of help, and there's a lot of great educated physicians out there that are working dedicated to this cause.
And this is exactly why you're here today, because you can go on the website, you can tap into these support groups. When we talked about the support groups last segment, they're there for you. There's so many people going through this at the same time. You can learn things from other people and realize that you're not alone.
Wendy, I run a support group in Livonia, and just in my Livonia group, I have over 300 members in my support group in Livonia. And like I said, we have over 70 support groups through our 83 counties in Michigan.
We're here for you.
The walks are also really great because there's over 900 people that were going to be at the Metro Detroit Walk. And so to see that community all come together and know that there's caregivers, there's members of support groups, and individuals with Parkinson's all at this one event really gives people hope at these events. It's amazing.
So this is a time in our lives that we need to embrace. We need to educate ourselves. We need to just not be fearful, but we need to wrap ourselves around the resources that are available to us and know that we are all in this together.
Exactly.
Yes. So definitely reach out to Next Steps for Seniors at 248-651-5010. You can call the Parkinsons at
248-433-1011.
Thank you for tuning in to Next Steps for Seniors, Conversations on Aging. And remember to keep moving. We are here for you. God bless you.
Thank
you.